Welcome to the show, Talk with Your Doc. I'm Dr. Prashant, Jani, and our guest for today is Dr. Trevor Bond. Dr. Trevor Bond is a geriatrician at Thunder Bay Regional Health Science Center. And today we are going to talk about how to take care of elderly patients or elderly population during the pandemic of COVID-19. As you all may know, that elderly persons more than 65 years of age are at high risk for getting COVID-19 infection, and serious infection and death risk is very high in the elderly population. Hence, Dr. Trevor Bond is going to guide us during these difficult times. Thank you, Dr. Trevor Bond, for being part of the show.
Thank you for inviting me, and I hope I have some snippets of wisdom that may help people.
Thank you so much. As you know that COVID-19 pandemic, now we are in the second phase and number of cases are increasing also. So what would you advise for our elderly population? How should they take care of themselves?
So I think that we have to continue to do the things that are important to us. We just need to add another layer of caution and care when we're doing them. Exercise is still very important, and I understand that we're asked to stay home and isolate. We still need to get physical activity. As we get older and frailer, it's even more important to be physically active because we can lose our robustness and strength very rapidly. We need social connection. And this has been a big issue in the era of COVID-19, where particularly people in assisted living or long-term care have been so isolated that their social contacts haven't been able to be maintained. And that's causing issues over and above the issues around the direct illness of COVID-19 infection.
Yes, I completely agree with you on that. Social isolation has been a big problem during the COVID-19. What are the general signs and symptoms one should monitor in the elderly population so that they can approach medical care at early stage?
So I'm going to suggest that the higher risk you are, the more cautious and more vigilant you need to be. The problem with COVID-19 is the symptoms overlap with so many other infectious processes that it can be confusing. Do I have a cold or do I have COVID-19? Do I have a flu or COVID-19? Gastroenteritis or is this COVID-19? I think the issue is if you're frail or if you have a loved one who's frail, your threshold for seeking help needs to be low, particularly as COVID-19 can be very aggressive. You may not have the luxury of time to wait and see how things turn out.
So as soon as one has little bit of symptom, he or she should immediately approach a doctor. Is that what you recommend?
So I think, again, in the day of isolation, being able to access health advice by the phone, possibly even online, would be the first method or maybe the safest method. Before you show up somewhere, particularly if you have COVID-19, you don't want to be wandering into the emerge waiting room or.
Yes.
So I think using the phone or using an online method to get some advice and some guidance would be the first step. Before that, though, is if you have symptoms, don't wait and watch it out before at least getting some advice and some guidance. That's really what I'm trying to stress is,
yes.
You know, some people will stay in bed for 2 or 3 days. That might not be survivable if you're frail and you have COVID-19.
Yes. So if somebody is living alone and they have nobody to help them out at that particular time, so they should take up a phone and call the helpline or online clinic. Is there any online clinic available for them, or where should they go?
So So yes, there is. So if you have a family physician, you can call your family physician clinic. They'll have advice, and then potentially even have a phone visit with your family doctor or whoever's covering at the time. If you don't have a family physician, there's Ontario Health hotlines, and those can be accessed. And I think those might be the two first line vehicles to access information.
Hmm.
And from there, do I need to go to Emerge? If I go to Emerge, how is that process done? All that information will be available.
Okay.
If you're by yourself, again, I wish that people weren't alone and didn't. If you have really no social connection, you need to have a system in place whereby you can trigger some assistance if you need it.
Yes. So as you recommended, Ontario helpline numbers or call your family doctor. Is there any online clinic at this time, like where they consult the patients through telemedicine or anything like that?
So the other, so I left out the health unit as a place to call for information. I don't think there's an independent online clinic just for COVID-19.
Okay.
I think, you access, so the district health unit, I left that out. That should have been also included in the Ontario Health Line and family physicians
Mm-hmm.
as a mechanism to get information and to get put on the path to care if you need it. And
What are
then,
the general infection control measures would you recommend during this pandemic for the elderly? Like we wear the mask and social distancing, sanitizer. Is there anything else would you recommend?
the transmission is the same across all people. It's just if you're at higher risk, your vigilance needs to be higher. So what I would really be recommending is family members and friends of frail elderly people need to be that much more vigilant. Not just when you're seeing your elderly loved one, it's what did I do before that? Because I could get infected and be relatively well and pass it on without ever knowing I'm infected. So really as a society, we need to maintain mask wearing, social distancing, our family bubbles, so that we're not mixing with multiple people
Mm-hmm.
until we get this outbreak, the second wave, under control. Fortunately, now there are vaccinations, but we have to assume that we're 3, 6, 9 months from being liberated, even with the vaccinations available. So this isn't going to end in a week or 2 weeks. This is going to be a process at least until the fall is my guess.
Mm-hmm. Mm-hmm.
Until we can be vaccinated and as in the numbers that we need to reduce transmission.
Right. And recently we also witnessed quite a few elderly patients dying in the uh, uh, old age care homes. So that's why we need to take more precautions now for our elderly population.
Yes.
Would you recommend any particular eating guidelines or
Um,
healthy eating habits during this time?
so I'm always going to suggest eat a healthy diet, eat colorful fruits and vegetables, particularly in the winter. And I don't know where the research is going to finish on this. Vitamin D, people who were deficient in vitamin D had a significant increased risk of a bad outcome. And we know that in Northern Ontario, unless you're supplementing with vitamin D, you're going to be vitamin D deficient. So I think of all of the supplements that make some sense and may be helpful, vitamin D is probably the one I'd most recommend. And it is relatively cheap, and almost there's no downside at reasonable doses. And
Mm-hmm.
by reasonable doses, I'm going to suggest 1,000 would be at the very low end, probably 2,000 up to maybe 5,000 a day. And I don't think anyone will have adverse effects from vitamin D at that level.
That's good. And anything particular in the diet other than the vitamin supplementation would you recommend to prevent or to which can help them to boost their immunity during the COVID-19?
Um, so again, I'm referencing frail elderly people, not so much everyone who's robust.
Yes.
You need adequate protein intake
Hmm.
to make the proteins that your immune system needs to fight. And one of the things that sometimes happens as we get older is we're eating less protein source foods and more carbohydrates and simple sugars. And so we may be somewhat protein malnourished in certain situations. And so if we're watching for something that would be adequate protein, and then of course you want all your micronutrients, which you'll get from fruits and vegetables primarily. Many of your micronutrients and vitamins will come from your fruits and vegetables.
Yes, yes. So taking care of your diet, having high protein diet, vitamin supplementation. You mentioned about active lifestyle. People should go out for a walk even there is a snow or there is a winter.
Yes.
Uh, what would you recommend for other than walking? Is there any other thing you would recommend for them to keep a healthy, active lifestyle?
Yeah. So again, we're talking about a pretty big range of physical health.
Hmm.
If we're just talking about elderly people, from very robust to very frail, everyone should get exercise. If you're at risk for falls, if you're using a four-wheeled walker, obviously with snow and ice, being outside might be a high-risk endeavor.
Hmm.
If you're living in a place with long hallways, excellent. If you have stairs where you have railings and you're robust enough to be going up and down the stairs, that is excellent exercise for frailer people. Even I'm watching TV, a commercial comes on, stand up, sit down, stand up, sit down 5 times every commercial, right? 6 commercials in an hour, you've done that 30 times. That's significant exercise for a number of people. So I think, you have to kind of find your level, and the exercise is meant to push you a little bit past your baseline. And the idea is to do it regularly, not necessary for hours and hours. Even 1 minute exercise is of value. And if you did 150 1-minute exercises in a week, you'd be getting your exercise.
That's really
So,
nice. Yeah, yeah, that's really true. That 1 minute times 150, that is what is the need of weekly
yeah,
exercise needs. So that's really nice suggestion. Yes, and the exercises which you recommended, like just like get sitting up and down or walking upstairs, downstairs, walking in the hallway, simple exercises which can keep elderly fit.
yes, yes.
Uh, some elderly population they call snowbirds. They like to travel in the winter. So for them, what would you recommend at this time?
Uh, well, I mean, if you haven't left yet, it's getting harder and harder to leave. If you are in the United States, right, you're probably even more, well, you probably should be more restricted than you are here. I'm not saying come back. The one thing about being in a warm climate is you actually can be outside. And if you can keep physical distance, being outside in the sun is probably good for your mental health, physical health. There are certainly advantages to being physically active in a warm environment. Um, the travel's the issue, because now you're on a plane, and we've had this 3 plane flights into the Thunder Bay recently had COVID cases on them, and they're telling people in X seat to X seat to isolate. Well, if you happen to be a frail elderly person and you get COVID while flying, you still got COVID. Planes are contained areas. It's hard to social distance on a plane, depending on how full it is. And so those are risky endeavors. And so I'm going to suggest that maybe one winter at home, and hopefully we get past this or get it under control, and it's safer to go the next winter versus going and dying. You have to decide how important the vacations are. I
Yes.
also get that as you get older, there's less and less opportunity to go. So I understand that as well. And we've had, I want to say, a fantastic winter to date for
Yes.
Thunder Bay.
Yes, for sure. We have a very mild winter this year, fortunately. Uh, what recommendation or what sort of information would you like to give to the caregivers, how they should take care of elderly because of the social distancing, how often they should meet them, what should they do?
I think it's hard to give blanket advice. Um, so you have the person's needs. So if you need to be there 2 or 3 times a day, well, then you need to be there 2 or 3 times a day. I think then the vigilance is not on those visits, it's on what you're doing the rest of the day. And hopefully you're not a cashier in a grocery store and having to go see your mother in the evening because there's just so much risk of exposure. I'm using that as an example. And I get that methods have been put in place to protect the cashiers. It's just, these are things that we're going to need to weigh.
Hmm.
What we're doing away from our loved ones, and then we're going to our loved ones. We'd hate to be the vector that brings COVID-19 from point A to point B and cause our loved ones to be sick. So for caregivers, it's the vigilance everywhere else. And maybe what you do is you, first thing in the morning, you shower, change your clothes to fresh clothes, go see your loved one. And so there's no interaction. And at least then you could be showered and change your clothes the next
Hmm.
day. And if you're seen once a day in the morning, it's the first thing you do. And then you, for the lack of a better word, decontaminate yourself in the evening and start over again. That might be a system that you put into place to minimize being a vector to transmitting the condition or the disease.
Absolutely, absolutely. That really makes sense that you clean yourself, have clean clothes, sanitize yourself, go and see elderly, then you reduce the risk of being transmitter to them. Uh, there are some elderly population having diabetes, heart disease. What sort of recommendations or suggestions would you like to give them?
So, so you've just mentioned two conditions that increase your risk. So again, that puts you into a higher risk category for a bad outcome if you get COVID-19. I'm not sure I have any specific recommendations. It's just people at high risk need to be that much more vigilant,
Hmm.
and their family and friends or their contacts also need to be that much more vigilant.
Yeah.
And if we could all keep our vigilance that high, we would have this thing under control.
Yes. Yes.
And unfortunately, I understand human nature. It's very hard to be that contained every
Hmm.
moment of every day. So
Yes.
um, it's a work and effort.
Yeah, if a diabetic patient can control their diabetes, control their diet, take medications regularly, and do physical exercise, probably that might help them to stay healthy even during the COVID, right?
I would think so. Yes.
Perfect.
Yes.
Yeah. Yeah. Uh, uh, anything else would you like to say before we end this interview?
Um, so I think not so much to the elderly population, it's to the rest of us.
Yes.
This is an inconvenience for everybody, and we have to extend our care and compassion beyond just us and maybe even our immediate family to think about the ripple effects that could cause significant illness and injury for other people. And I think as a community, that's going to foster a more interconnected state, and that can only be good for us, not just during COVID-19, but going forward in all circumstances.
Before we end, let me ask you one more question. What would you recommend for keeping mental health strong? Like because social isolation, quarantine, and staying away from our family and friends, it's a difficult time, especially for the elderly population. So, what
Yeah.
sort of mental exercises would you recommend for them?
Yeah. So that's an excellent question. I don't know that there's any one answer. I think mental, emotional, spiritual health is important.
Hmm.
So things that I think can be beneficial if they're safe, being out in nature. There's all sorts of positive, I believe, positive outcomes from just being out in nature. So if you can get outside and feel the sun on your face, like today, it's a nice sunny day, that's probably going to be beneficial. If you are isolated and you can, like you and I are communicating through Zoom, but FaceTime, however, even on the phone, voice
Hmm.
contact, all that's still social contact.
Yes.
If you're spiritual and you have a practice, continue your spiritual practice. If it's religious or, right, are there internet connections that you can meet with people virtually and still get some of that human contact and support? And those would be the things. And then staving off boredom. If you
Yes.
are locked down and your world becomes your room or a very small area, that leads to restlessness and anxiety and poor sleep and all kinds of other things, and bad habits like not exercising or watching hours of TV, things like that. You then need to, I think you need some sort of routine where you have a practice that's good for your mind, good for your body, even if it's a 20-minute meditation or even if it's whatever it happens to be, not even if,
Yes.
a meditation, a prayer, a little bit of exercise, maybe all three of those things. And I think those are things that can discharge some of the anxiety and the restlessness if you can maintain some routine and practice.
Yes.
And I'm
Absolutely.
sure online there's all kinds of information about how to do this.
Yes, yes. So taking care of your physical health with exercise, mental health, spiritual health, taking care of your diet, vitamin supplementation, keeping a social distancing, uh, all the safety habits like using masks, social distancing, using sanitizers, and following the healthcare guidelines. Taking the advice of a doctor as soon as you have mild symptoms. That's really a lot of wonderful and useful information. Thank you, Dr. Trevor Bond, for your time.
You're welcome, and thank you for inviting me.
Thank you
Have
so
a good
much.
day.
Thank you.
Stay safe. Bye.